There is a clinical encounter happening millions of times every day in this country that almost no one in medicine has thought to use the way it could be used. The recall appointment at the dentist. Most people see it as a cleaning. The hygienist scales, the dentist examines, you book the next one in 6 months, you leave. What that encounter actually is, looked at from a bioenergetic perspective, is the most consequential underused clinical window in modern healthcare. Consider the structure of it. The dentist sees the patient asymptomatically. The cardiologist does not, the endocrinologist does not. The patient is in the chair because the calendar said so, not because something is wrong. Which means the appointment captures the patient at exactly the moments medicine has the most leverage. Years before the symptom, years before the diagnosis. The dentist sees the patient longitudinally. The patient who attends recall every 6 months for 30 years has been examined at the oral systemic interface 60 times by the same clinician, with the same instruments, assessing the same tissues. No other clinical encounter in the modern system produces this. And the dentist sees the patient demographically. Approximately 20% of American adults have not seen a physician in the past year. Approximately 30% of adults with hypertension are undiagnosed. Approximately 30% of adults with type 2 diabetes are undiagnosed. Approximately 80% of adults with sleep-disordered breathing are undiagnosed. The dental practice reaches populations the medical system does not. For a substantial fraction of the population, the dental chair is the only clinical encounter that happens at all. Volume 27 of the Living Energy series is called the Bioenergetic Dental Reference, and it is the volume that takes this access and shows the dental clinician what to do with it. It opens with a single reframe. The oral cavity is not an anatomical inventory, it is a bioenergetic system, 5 simultaneous things at once. A developmental platform. The face, the airway, the dental arch were built in windows whose architecture remains readable in the adult patient's mouth. A circadian immune surface. The salivary IgA, the cathelicidin output, the gingival inflammatory tone are direct expressions of the patient's first levy circadian status. A systemic inflammatory window. Bleeding on probing above 20% is a systemic inflammatory event, not a local dental problem. An airway architecture entry point. The shape of the upper jaw, the position of the tongue, the grade of the tonsils predict obstructive sleep apnea decades before any sleep study. And a piezoelectric bioelectric field. Every tooth in occlusion is generating electrical signals that organize the alveolar bone's remodeling trajectory. The book then walks the 8 confirmed bioenergetic levies across the oral cavity. Light, voltage, water, membranes, metals, microbes, structure, airway. And it introduces a 9th levy candidate, the oral microbiome itself, with the evidence assessment that designates it candidate rather than confirmed. Because the series applies the same standard to its own framework that it applies to the literature it reviews. Part 1 is the foundations, 11 chapters that every dental specialty references but none owns. Part 2 is general dentistry, Part 3 periodontics, Part 4 endodontics, Part 5 oral surgery and orthodontics, Part 6 prosthodontics, pediatrics and dental sleep medicine, Part 7 orofacial pain, oral medicine and dental public health. 11 specialties, 1 framework, every chapter derived from the same 8 levies. The book is what every dental specialty has been quietly waiting for, not a continuing education course on systemic links, the operating system underneath the practice. If you are a dentist who has suspected for years that what you see in the mouth is connected, at the deepest physical level, to what is happening in the rest of the body, if you are a hygienist who knows the inflammation you measure every day is telling you something the medical system is not listening for, if you are a clinic owner trying to position your practice as something more than the cleaning, the cavity, and the crown, this is the volume that operationalizes what you already suspected, the Bioenergetic Dental Reference, Volume 27 of the Living Energy series. By Catherine Hornbeek, read the book.